Hey everyone, this is Victor from Cyborg for Life, and I want to welcome you to episode 116 of Limb Lengthening Live, where the patients interview the guests. And today we are doing a leg lengthening discrepancy roundtable for patients who have a leg length inequality, which means one leg is shorter than the other one. And today we are joined by Ethan. He is a leg length discrepancy patient. He was here on the show before, and he's back to give you guys an update about his condition. So welcome to the show, Ethan. How are you doing, man?
I'm doing all right. How about you, Victor?
Doing great, man. So first of all, thanks so much for joining us. I think it's super exciting to talk about this topic because I've been getting a lot of discrepancy patients reach out to me recently. I'm not sure why, but it seems like it's discrepancy month or something. But no, so we're gonna kind of flash back. If you don't mind giving us a summary of like your condition, how you kind of, develop your discrepancy, and then when you decided to make the decision to kind of look into limb lengthening.
Yeah, so for me, mine is congenital. Obviously, I know some instances you might develop a limb length discrepancy. Like say if you had a hip surgery or if you broke your femur or something, sometimes it heals shorter and people develop a limb lengthening discrepancy that way. I was born with mine. We didn't discover it until I was about probably somewhere between 5 and 7 years old. That took a while actually, and so I started going to a local children's hospital afterwards to try and figure out what to do about that and what the long-term implications of my discrepancy were going to be. The interesting thing about my discrepancy is not like it's not necessarily a unique case, even though limb length discrepancies are somewhat unique among the general population because they don't affect everybody, at least not to the same degree. But I also was born without an ACL in the same leg, ironically enough, and I started at certain points in my life, I started to feel like a new medical case because some doctors I've been around have been like, I've never seen that before. And so we'll have to, they start talking to their peers about my condition and they're like, yeah, what do you think we should do about this? Because I've never seen this combination of conditions. But so we discovered mine around that age. And originally we opted to do the shortening route, not taking bone out of the longer leg, but slowing the growth of the longer leg in order for the shorter one to catch up. I had I think in my youth, probably about 6 surgeries to do that. I'm up to 10 now,
Wow.
and, we have, since I never closed the gap enough between those legs, even though we slowed the growth, I ended up opting to do the limb lengthening surgery to close that gap, over the last, I had that surgery last October on October 9th, and when I was younger, it was probably about I believe somewhere between like 3.5, 4 inches discrepancy, something like that. Might have even been more. And by the time we had to do this surgery, the lengthening surgery last October, it was about 2 inches, I believe. So not as bad as it used to be, but still enough that my surgeon felt that I'd probably have to have my hip replaced before I'm 30 if I didn't do anything to address it. And obviously, there's other long-term implications with it, like arthritis, and my ankle joint on that left side developed somewhat abnormally because of the discrepancy. Me walking around on my toes most of my childhood, but so yeah, since that point, I've been recovering and. So far, I've done nicely. There was a snag at one point where that we thought that there might be potential complications with the nerves and with the peroneal nerve in my left leg, and that it was becoming overstressed and over extended, and that there was going to be nerve damage, although that seemed to pass with time. It's not always the case, but it can be indicative of it. Outside of that one possible snag, the process has gone well for me. We hit our lengthening goal, and since then I've just been kind of waiting for the bone to fill in, and I'm about 2 weeks away, hopefully from being full weight bearing.
Dude, that is so exciting. I mean, that was a huge journey right there that you went through. I mean, you were born with a discrepancy. They did limb slowing, where they try to like slow down the limb from growing a little bit further, creating the bigger discrepancy. And you left with, what was it, 2.8 centimeter discrepancy?
Yeah, I believe so.
2.8, and then you decided to go ahead and get the lengthening done, but you were also born without an ACL in that leg. So that was a very rare condition, but it seemed like lengthening kind of offered you the solution to kind of treat this. Because I know that, as we were conversing back and forth a couple months ago, you mentioned that this was a very big decision for you because you were very athletic, and you just wanted to kind of like have your future laid out in terms of like full on recovery. So what was the lengthening process like for you, Ethan?
Well, personally, I thought, and I don't know if this is because pain tolerance varies per person or because my experience was just different than other people's, but I personally thought it was going to be a lot more painful than it was. It wasn't
Okay.
bad, for me, at least. It was a little strange at first, and there definitely were points in the recovery itself that were more painful than others. But for me, the lengthening sessions went well, and maybe that's also because I did my best to stay on top of my stretching, my physical therapy at home, at least what was within my control. So for me, the lengthening process actually went very smoothly. It was really just getting over the initial stiffness and pain of the beginning of the surgery, because obviously they break your femur in half unless they do tibial lengthening. They break your femur in half, and you just have to recover from that.
Yeah, absolutely. I mean, that's crazy. I think that you're right. I think that the rehab and the stretching definitely helps, mitigate a lot of the pain during the lengthening process. But here we are, 2 weeks, or like what you said, 10 days or so before you're kind of cleared for full weight bearing. Are you excited?
I'm very excited. I've been on crutches a little longer than I anticipated, and obviously I'd rather it heal correctly than quickly. But I've been looking forward to this for a long time because I've never taken a step in my life where I've had an even base and a normal gait and stride and all that.
That's crazy, Ethan. And you can kind of give me like an age range where you fall. Is it like in the early 20s, 30s? What's your age range?
Yeah, I'm early 20s.
Early 20s. I mean, that's incredible. I mean, man, that's when I had mine done and it changed my life, and I'm living the best of my life right now. So awesome, man. I'm super excited for you. Great. And we have another leg length discrepancy patient joining us here today. We have Sam. Welcome back, Sam. How are you doing?
Doing good. Doing good.
Thanks for joining us, man. So I knew I had to get you on because you also have a very exciting update for everybody. So if you want to kind of like share, so what we did with Ethan here, Sam, we basically had him give us a summary of his leg length discrepancy journey, kind of like why he got it done, and then basically his decision to get lengthening done, and then finally where he is right now and where you kind of are right now. So go ahead and do the same thing.
Okay. So I was born with a curved shin bone, and that caused that, along with the treatment that I got as an infant, slowed the growth in my left tibia and my foot. But that's a different story. And so every 6 months, I would go in and take x-rays to keep track of the discrepancy. And as I became a teenager, the discrepancy started increasing because I started hitting growth spurts. By the time I was 14, the discrepancy was a little over 2 inches. So, I mean, it was at that time, it wasn't causing me pain, but it was about to. So, we went, and this was in the late 90s. So we went to a couple different places, including Stanford Children's Hospital, to get consultations. And at that time, lengthening was using the Ilizarov procedure with the external fixator. The orthopedic surgeon that we talked to had only ever done it once before. And so he was like, "Oh, I'd like to do it a second time." And we were kind of like, "Yeah, I don't know about that." So instead of doing that, we actually got a recommendation to slow the growth in the right tibia so the left leg could catch up. So I had that done when I was about 14, 15 years old. And it seemed to work in that I didn't have pain in my back or my knee or anything. So I just accepted that that had solved the problem. Went on with my life, played a ton of soccer, went through my life without really thinking about it until last year. My wife jokes that turned 40 and your body basically said, "Forget this, I'm not working anymore." And so that's when all of a sudden I couldn't go upstairs, I couldn't run, I couldn't push off that leg without severe knee pain. So started going to physical therapy. First thing the physical therapist noticed over a video appointment was, "Hey, your legs look like they're different lengths."
Wow.
And I was like, "Yeah, but I thought we took care of this when I was younger." And she goes, "No, I don't think so." So when I actually went in, she did a hand measurement, and her hand measurement was that the difference of about 3 centimeters. Yeah. So then I talked to the doctor, talked to the orthopedic surgeon, and he said, "Yeah, we can do the lengthening." And of course, by this time, internal nail, internal rod. And so we talked about it, went through it. We ended up doing 24 millimeters in the tibia. That finished in January.
Okay.
Just last week, I had a checkup, and my surgeon said it looks good enough. You can start weight bearing. You can start weaning yourself off of crutches. So that's what I've been doing for the past week, is practicing trying to walk. And I tell you, I never thought so much about how you have to bend the different parts of your leg to walk until now. Like, I swear I'm overthinking it. But it's like, okay, when do I bend my knee? How does my ankle flex? When do I put off? How big should my steps be? So it's been a really nice week. It feels very weird because it feels like I'm almost too far and now going the other direction, but it's because my whole life I've been kind of leaning to the left, and now I'm even. It just feels off. Yeah. But I'm really excited to start walking, and I talked to my surgeon about goals for the rest of this year, and my college team, we have a 2-year reunion of the year we made it to the national championship game, and that weekend there's a 5 and 10K and a half marathon. So with a buddy of mine, we signed up for the 5K, and my goal is to just finish the 5K, whether it's walking, running, a combination of the two, but just to finish a 5K.
That's incredible, Sam. Dude, I'm super pumped for you. I mean, remember you sent that to me the other day, and you said you would just want to finish the 5K. It was, for me, it was getting back to bodybuilding, and like it's kind of like this. The story comes full circle. It's like you had this huge tribulation with limb lengthening. You didn't know how it was going to turn out, right? You just wanted to kind of get rid of the pain and get rid of like this discrepancy. And you guys apparently lengthened a little shorter. You said 2.4 centimeters. So you didn't do the full 3. Is that because he was worried about too much of an adjustment?
No, that's actually what was interesting. Was when we did the initial x-rays to look at the length, there was a difference when I was just standing, and then we did x-rays with like a block under the foot to try and level them out. And when we just did standing, it looked like the difference was 3 centimeters. When we did a block, it looked like it was closer to 2 centimeters.
Gotcha.
So he said, okay, it's going to depend on how your body responds. Yep. We're going to take standing x-rays as we get closer to 2 centimeters to see how far we actually need to go. And so when we got to about 2.5, it was like, okay, you're even. So we're going to stop here.
Right. No, that's actually what I want to kind of figure out, because and this is a really good point you bring up, because, and I'm not sure if this happened for Ethan or not, but a lot of surgeons, this actually happened for me, actually, when I was getting measured. A lot of radiologist techs and stuff like that, and even, I guess, inexperienced orthopedic surgeons, when they're measuring a discrepancy, they'll just do a full standing x-ray, but they necessarily won't do the block method. And if you don't do the block method, you can't really tell how the bone structure aligns properly, your spine, all this stuff. So by sticking some blocks where they can kind of know they have the known amount of length of the block. How many did they put under you? Like maybe two slides or something?
Yeah,
like that?
They put 2 1 centimeter blocks to start with. Yeah.
Yeah, for me, they easily hit 3, and then she actually was going to do the 4th one, but she could kind of tell. It was enough to kind of be able to measure it better. It's just so that you can get the hips lined up better, and they can get a better assessment when they do the full length standing x-ray. So that's incredible that they use the block method on you. That's a more experienced technique, but I see it all the time. Discrepancies are misdiagnosed, and people get lengthening, or they overshoot, or they undershoot, or they just live with a shoe lift and they still have a discrepancy and they don't know about it, because there's induced scoliosis of your spine, and your spine will compensate for the discrepancy, and that it'll hide in there. So you can actually, really live with a discrepancy for the rest of your life if you don't do it right. So that's incredible, man. So pumped for you. So you're walking now, you're adjusting to the walking gait. I'll tell you, I remember that was a very big hurdle for myself, because when I got back, I was tripping. I was tripping on my new leg, my lengthened leg, for a while. I was like, whoa, this feels so weird, because you're right. For so long, you're used to that big difference. So Ethan, are you able to put any weight on your leg right now?
Yeah, I'm allowed to do up to 50% weight bearing, which is, according to my team, that's obviously fairly subjective. But they said if I want to use like a scale at home to kind of estimate half my body weight, I can. I believe the nail that's in my femur is weight bearing up to something like 50 to 70 pounds. So you're not supposed to during that period when you're not weight bearing, you're not supposed to put weight through it. But if you put some weight on it, it would survive. But as of
Hmm.
right now, half my body weight, yeah.
Half your body weight. Very cool. Yeah. And Sam, did they kind of you said they kind of weaned you off as well.
Yeah.
What was the
So
gradual progression for you?
yeah, I got last month, towards the end of February, it was okay. You can start putting half weight on it, and my physical therapist was like, okay, practice the walking motion even with your crutches,
Yeah.
and put a little bit of weight on there so your body starts to get kind of used to that motion. So yeah, it went from half weight a month ago to now full weight.
To full weight. And that's what he's actually at that kind of that crossroad rate starting the next 10 days here. That's incredible, guys. Awesome. It's so cool to hear these stories of discrepancies. It takes me down memory lane. I love it. So awesome, awesome, awesome. Okay, so let's see if there's any questions in here. I don't know if there's a whole lot of, looks like somebody's commenting about, they're just talking amongst themselves. Yeah, they don't have any questions in here. So what I want to do now is kind of just talk a little bit more about the points of discrepancy, because I have a video that I'm going to be making on discrepancy the next couple of weeks here. And let's see here. So Ethan, I want to talk about like for you, did you have any type of, did they check your spine when you had your x-rays made? And did you have any type of curvature before you got your lengthening done?
As far as spine, I'm not sure. I think that they checked it. I know that we spent a lot of time examining my pelvis to see what it looked like and what the base looked like, where the crests came up to, and how much of a difference there was between the two of those with me standing flat-footed, and also, like you mentioned, the block method. I've done that for X-rays and other images several times in my life, including before surgery, this last surgery. But yeah, I know we had some conversations with my surgeon and his team about curvature of the spine, and they mentioned that they thought that mine looked good. I don't remember if we did any specific images of it, but I imagine they saw it in some of the x-rays we took.
Okay. Yeah. And it's going to usually be somewhat corrected if it wasn't like, congenital scoliosis, meaning from birth. A lot of times
Yeah.
it's induced. It's because of the discrepancy that it's induced. I had that. Sam had that probably as well. And Sam, you were an athlete. So you played soccer, like you said earlier. You got to the national championship, big soccer player here. How did that impact your sport before you got lengthening? Because I mean, there's a lot of people who would probably come across this video and they're like, you know what, that's me. I'm a soccer player, basketball player, athlete. And it's like, I have this discrepancy, but is it worth going through, this process to get it corrected? And can you kind of give them some words of advice there?
Yeah, I mean, if this procedure was available when I was growing up, I absolutely 100% would have done it. Looking back on, playing soccer, I can now pick out things that I remember that I would have been either better at or more physically able to do had I not had this discrepancy. I mean, I got used to, and my muscles compensated, but I would lock my knee a lot. Off my right leg was very, very strong. And so I could take 2 steps and dunk a basketball when I was in high school and college, but I couldn't jump off my left leg. It just didn't work that way. So I always constantly had to be thinking about that while I was playing. Like I would get maybe 2 or 3 inches off the ground if I tried to jump off my shorter leg, and it was just the musculature and the muscle chain to do that wasn't it just didn't work that way. So thinking back on it, I'm like, if I had been able to lengthen my leg when I was a teenager, I think I would have had more success than what I did. And I'm not saying I didn't have success. I had a lot of success. I was able to travel all over the world and play. But I go back and I think about that. And if this had been available then, with even kind of, I'm looking at a year before being able to sort of be active and maybe get out and run on the field again. As a teenager, that's not a long time. But what I was told back then was, this will take 18 months to 2 years to recover from. And the thing that scared me the most was they weren't necessarily sure of the long-term stability of the bone. So I was told it could break, with minimal impact. And I'm like, I'm out here playing soccer. You can't tell me that my legs might randomly break if somebody gets it wrong. So looking at the difference between then and now, I absolutely 100% would recommend this for anybody who has a discrepancy, who wants to be an athlete, because there's just so many more things that you can do when you're even. That you have to find workarounds for you if you have a discrepancy. Like I had to find workarounds even just for normal workouts, in the gym, doing leg raises or even leg presses. You have to kind of contort your body a little bit to make sure that you're using both legs together. So yeah, I would absolutely recommend anybody who has a discrepancy to really look into this. And I think it will definitely not only improve the quality of life, but improve athletic performance.
I love that. Fantastic point there, Sam. And I want to kind of ask you a little bit about that, because you say kind of contort your body when you're doing lifts in the gym, or like when you say that you could, if you had this done way back when, you could have probably done more than you did, even though you did really well. And I feel the same way for a lot of my sports and stuff like that I did, primarily bodybuilding. But can you talk a little bit about like any type of, like, let's say that after a hard game of soccer, what did you feel in the musculature? Like, let's say, was it like tightness, spasms, burning, exhaustion? What did you feel in the different sides of your legs from the shorter side versus the taller side?
So a lot of what I felt was tightness in my shorter leg.
Yeah.
So I didn't have the same sort of muscle strength or muscle flexibility in my shorter leg. So I would feel a lot tighter, especially in my calf. I'd feel a lot tighter in my left leg, shorter leg, than my right leg. My knee would be more sore. Especially, this was something I found out as turf fields came into popularity, was the springiness of the turf really shot through my knee and to my lower back on the left side. So I would probably characterize it most closely with sciatic pain.
Yeah.
But what I would have, not often, but regular enough, is like a misstep or something, and I just feel a pain shoot all the way up my leg into my lower back, and then my leg would feel weak for a couple days, a week afterward. Every time I would take a step, I'd feel it in my lower back, and the whole leg itself would just feel weak and not stable.
Yeah.
So that's kind of, that's what I'd go through.
It's crazy. That just reminds me of a specific event that I did. I was training with this strongman at my gym way back. I think it was in 2010, 2011. And we were doing farmers carries with, I think it was like 200 pounds in each hand, something stupid. And I think I felt the same thing when I picked it up. It was like a jolting, shock of pain that went through my knee to my back. And it felt really weak, and it felt like that for 2 weeks. And I had to take a lot of anti-inflammatories to kind of get rid of it. And it's just like, holy crap, what was that? And that's where we really brought on, the discussion of, should I get the shoe lift build and stick with that, or should I just go ahead and, look into this procedure that I kind of found out a little bit around there. And, I was on that crossroads of making the decision, and I eventually went for limb lengthening. But that's incredible that you're saying that you would have made the same decision earlier if this option was there. Very cool, Sam. Now, yeah. Ethan, I want to go to you now. You said that originally they did limb shortening for you, or like kind of like they retarded the speed of the growth of your taller leg.
Mhm.
Now, if let's say that you found out about limb lengthening early on, or you came across a limb lengthening surgeon and said, hey, we're going to use the multiplier method. We're going to figure out this. We're just going to do multiple lengthenings, sequential lengthenings over time to kind of just do lengthening. If that was the case, would you have done that instead of like slowing the growth of the taller leg?
Well, obviously, it's complicated when you're doing not only multiple lengthening surgeries, but also trying to predict the length that you have to reach when you're still growing.
Yeah.
Obviously, there's complications with that, but knowing what I know now, since obviously when I was a child, I wasn't really old enough to make these decisions for myself. Looking back on it, I probably would have just gone with lengthening from the outset, and the reasons for that are because one, you can offset a lot of the confounding variables or conditions that emerge as a result of the discrepancy over time by pushing it back. So like you have a discrepancy, you start out, maybe you have an initial surgery that gets you pretty even, and maybe the growth rates on each leg are different, and so you develop a discrepancy again over time, but you're still pushing back the time frame. For me, if, like I said, my left ankle developed abnormally. It's more like a ball and socket joint like your shoulder is than it is a traditional ankle joint. So I have limited extension and dorsiflexion as a result in that. And my reliance on my longer leg for most of my childhood, I've got, you could see it if you saw my legs. I'll get some documented photos of them later, but one of my legs almost looks like a child's leg, and the other one looks like an adult's leg because of the difference in muscle atrophy between the two of them. But avoiding those sorts of things and developing a mental representation of proper biomechanics utilization, and how to walk with a normal gait, even if obviously you may have to go through multiple surgeries. I mean, I went through multiple surgeries anyway. But looking back on it, I think that I would have gone with the lengthening from the outset, even though the technology is obviously getting more advanced every day than it was in the past. But I can't speak to everyone's circumstances, but for me in particular, I think that looking back on it, I probably would have done the lengthening from the outset to avoid those additional circumstances that emerged from my discrepancy to begin with.
Absolutely. Fantastic answer. And that's why I was kind of like asking that question, because I think that, a lot of the more experienced limb lengthening surgeons nowadays, they use that multiply method, and it's pretty accurate, if it's done. And I think they created like an app or something. You can kind of use it now where you can kind of like put in the information, and it kind of gives you a good turnout of what to expect. But you're right, there's a lot of complications that can kind of occur with that. But, I think that one thing is that you don't create any type of, like, let's say that you did that and you got lengthening. So it was your shorter leg that had the missing ACL?
Correct.
Okay, gotcha. Yeah, and I was just wondering if maybe some of the connective tissue structures and stuff that would be altered when you do the shortening on the other side. So there's a lot of things that can happen either way, but it's really cool that in hindsight that you would have gone for the lengthening either way. So very cool.
And something you said, sorry to interrupt, something you said reminds me of another reason why I'd probably do it that way as well, is my muscles are a lot tighter in that leg as a result. So you notice that, and you got to be diligent about therapy now that I've done the lengthening procedure. And even after surgery or during surgery, my surgeon had to release my IT band as well, because he says it's never been under that much stress, and you're going to have to release it to get a normal range of motion. So, avoiding having to release different connective tissues and bands down the road when you have the surgery, that could also theoretically be avoided if you were to do lengthening from the outset.
That's very true. That is very true. Yeah. And your surgeon seems pretty experienced. He seems like he had treated a lot of these discrepancies before, at least the one since you just got lengthening, right?
Yep.
Yeah, very cool. Awesome. Very cool, guys. This is so cool to talk about discrepancies. I was supposed to have another guy come on here today, and he had a very unique case as well, because he is getting lengthening done, but unfortunately his insurance in the country that he's at, it will only cover the Elizaroff method. And I think he's going for something like, he has an 8-centimeter discrepancy, which is almost 3 inches. And to do that type of method on your femur, I think it's really rough. He was planning to go for the internal method, but yeah, insurance only covers one thing. Hopefully we'll get his story at some point. But let's just see if there's any questions in the live chat from any discrepancy patients. I don't know. Well, since I started this channel, I've been trying to really give more limelight to stature length, and I think that it's kind of, the algorithm has picked that up, so I don't get as much eyes for discrepancy. But they hit me up an email, but not as many in here. But so Sam, do you have any questions for Ethan about his condition or anything like that, or?
I guess it sounds eerily similar that, having this discrepancy since birth and having a kind of a malformed ankle joint, because my bowing of my tibia and fibula caused my ankle joint to be tilted basically. And so I have limited flexion in my ankle. And so part of what part of what my surgeon was worried about when I first went to him was, are we going to need to release the Achilles prior to lengthening or as part of the lengthening process? And he was kind of surprised at how much I actually could move my ankle. But now that I've done the lengthening, like, I personally feel like it's so hard to pull my foot up. And we'll see if that gets any better over time. But so Ethan, how's your ankle now that you're got a little bit of weight on it? Has you noticed anything about the flexibility in it?
Well, obviously I've always had limited dorsiflexion in that ankle, but I've noticed that it's been a little tighter post surgery. But like I said, I've been trying to be as diligent as possible about doing the dorsiflexion stretches I'm allowed to do for the time being, so I don't lose all of that. But it's still going to be limited going forward. It doesn't look like the surgery has limited it to any degree that I can't gain back through therapy, but I guess time will tell. But ironically enough, listening to your story too, you were talking about your tibial curve, or at least the angle at which it kind of was bowing. I've also been told that my left tibia is kind of bowed at an S curve as well, but not to the degree it sounds like that yours is. But I just found that interesting that we both kind of experienced that, although yours much more pronounced.
That is interesting. Yeah, and Sam, yours was from birth as well.
Yep.
Yeah. So you know what I find is that usually from congenital discrepancies, which is what it is from birth, you see tibial bowing. You sometimes see a missing fibula, which is, something called fibular hemimelia, which we had a guy on last week, father of a girl who had that. And they can cause discrepancies. It could be tibial hemimelia or congenital femoral deficiency, which all create discrepancies. But when you get sometimes congenital conditions, they have that bowing, that curve, because the bone actually forms like that. Whereas if it's traumatic, like mine, which was from an accident, a lot of times you'll get malunion where the bone will just kind of hang like this. It can damage the growth plates, which stunts growth, but you also sometimes get a break that heals and you lose your height because of a fracture that doesn't heal properly. So it's crazy, but it's just so cool that, at the end of the day, as long as they do the osteotomy, things are safe, they implant the device and they lengthen over time, you can kind of fix a discrepancy. And did they fix the curvature in your bone, Sam?
No, they didn't feel comfortable trying to fix that curve. They're just like, we're just going to leave it. We actually had a consultation with the manufacturer's rep to make sure that they had a rod that could work, because of course the rod's straight. So depending on where the curve started in my shin, it was, we might not have been able to do the rod because there just wasn't enough above and below for the rod to be able to be implanted. But luckily we were able to do it. We did use a smaller gauge rod, so it's a little bit smaller than what normally would be used in a tibia for someone my size, but we were able to get it to work.
Which where was the curve? Was it more like proximal at the top, or like in the diaphysis, which is like the main part of the shaft of the tibia?
No, it was in the bottom third of the tibia is basically where it is. So it curves one way and then curves back to the other and then goes into the ankle. So it's really the technical term is posterior-medial bowing of the tibia and fibula. So it curves in all three dimensions.
Wow.
Rather than just like a bow and arrow of curving. Yeah. It actually curves there, but also curves to the front. So it's a really weird. my surgeon is technically a pediatric orthopedic surgeon.
Okay.
And so I had found some old X-rays from when I was a kid, and he was super excited to look at the bowing my X-rays.
He's like, well, I've never seen anything like this. That's crazy.
Yeah, this is cool. I haven't. What did he say? He said, I don't think I've seen one exactly like this. So,
oh, really?
He was really excited to see it. But
that's so cool. Yeah. I wonder about the because you got the internal nail. I wonder if you were to go for the external fixator or hexapod frame, because they can do multi-planar deformity correction with those type of things. Was it just your decision that, hey, look, I don't want to wear that thing, or did they just say that we can kind of achieve the same result with the internal nail?
It was a little bit of both. So I wanted the internal nail because I have a 4.5-year-old son,
Okay.
and I didn't want him to accidentally be grabbing onto. It was bad enough with the internal nail. He was super scared that he was going to hurt me, so he didn't come near me for a month.
Oh, wow.
But yeah, so I didn't want that. I also wanted the, but in weighing it, the surgeon was like, "We can do either or," but I think that if we're not trying to fix the curve, you'll get good results from the internal nail.
Okay. Yeah, no, that's true. I think that's what I was saying earlier. It's like as long as they break the bone safely in a spot, the osteotomy is in a spot where it's not going to mess up the deformity or the malunion or whatever the person has, then you can achieve the same length and just even out the hips. That's the goal, right? So
Yeah.
another thing here, and I don't know if this is going to apply to Ethan or not, but in my case, for example, I had actually a little bit of a overgrowth in my femur from an original break. And then I had that discrepancy was only like it was like 3 centimeters on my tibia. But then I wasn't going to break two bones to lengthen 1 centimeter on the femur, on my left femur, and then 3 centimeters on my tibia. So I said, let's put it all in the tibia. So we put 4 centimeters in the tibia, and that caused the knee height technically to be overshot. So my left knee is now taller than my right knee, but my hips are level. And that's what matters because that's where the weight is distributed primarily. But in things like a deep squat, like I was just doing front squats today, 3 sets of 3 with 315. Yay me! I'm just kidding. No. But when I was in the deep squat, like even like in my warm up sets, and I'm looking at myself in the mirror, and I can see the knees up like this. I'm like, man, there's a lot of shearing force, and I could feel my left knee taking a little bit more pressure. And there's not much I can do, but when I step out a little wider, it does even out a little bit better. So it still has its downsides because I decided not to do 2 surgeries and just get it all done with one. But for my sport, it was just like, I just sucked it up and, I have another year or two left with this. But yeah, so is it the same case in you guys' situation? Is it like hips are level, but the knee height is different? Or is that you're shaking your head, Sam?
Yeah. So my left femur is about a centimeter longer than my right femur.
Okay.
And then prior to the surgery, my left tibia was actually just about 4 centimeters shorter than my right. So even though my left femur was longer, the tibia was so short that it caused that discrepancy initially. So we thought about, hey, for a short minute, thought about let's even out the knees as well. But then it was like, it's 1 centimeter.
Yeah.
If we even out the hips, that'll be good enough.
Yeah.
So that's what we ended up doing. So yeah, my knees are still going to be off by a little bit.
Yeah. Yeah. So I think that's the one downside. I mean, you think about it's technically our proportional issue. Like, the cosmetic stature lengthening guys, they were like, oh, we're going to be off the proportions and biomechanics. Well, we have that too. So it's like in a deep squat with 315 pounds on your front shoulders, it's like there's a lot of shearing pressure going through that left knee. So maybe I'm going to have, early arthritis. I don't know. But Ethan, is it the same for you, or like what happened with your case?
Well, with me, as far as the lengths of the relevant bones, initially growing up, I was told that the entire discrepancy lied with my femurs, the
Okay.
left side being significantly shorter than the other. But one of the reasons that I went with this team that I had that operated on me is because they were the only ones in my entire life who discovered that there actually is a discrepancy in my tibias too. It's just that the majority is in the femur. So when they measured, I believe they said that my legs were off 3.8 centimeters from each other, but a centimeter of that lied in the tibia and 2.8 in the femur. So we ended up over lengthening my femur because I would have probably operated on both the tibia and the femur at the same time just to be as even as possible. But in my case, they said that since I don't have an ACL in that knee, they were worried about dislocating the joint. And so we slowed the rate of lengthening anyways because of that. But they would have had to split it up into probably like a 4 or 5 year process and multiple surgeries. So I ended up over lengthening the femur because my surgeon felt comfortable with that. But just at an eye's glance or based off of my own feeling, I don't notice the difference in my tibias too much. But I certainly notice the difference in my legs overall when I'd be standing up when you add both of those discrepancies together.
Yeah, absolutely. No, that's crazy. So you did what me and Sam did, but from the femur perspective. Yeah. So and Ethan, what's your like activity like? I know you said you're a sporty guy as well. What type of like physical activity do you do?
Well, I love basketball.
Oh
Basketball has
yeah.
always been my passion. I got to play as a kid. I played in high school and I actually played for my university as well before I graduated and ended up having this surgery. But yeah, I love basketball, and I do a variety of things for training related to basketball, running, obviously weight training and
Mhm.
calisthenics and stuff like that. But I consider myself pretty active, and my surgeon. One of the reasons I ended up doing this surgery, I know it scares a lot of people away, and certainly had its drawbacks for me as well when they talk about breaking your bone in half. But to me, my surgeon was like, honestly, you have very uneven base, and you've never been competing with like an even pelvis or even length legs or anything like that. So honestly, if this goes well, which he anticipated it would, and so far it has, it's going to make you better
Yeah.
athletically. So that's what I'm hoping for, and obviously I'm looking forward to starting to walk again and getting used to the gait as it is now. So I'm hoping that it just makes me a better athlete in the future.
Yeah, I can tell you guys if you fast forward a couple of years, like, or not even a couple of years, a couple months, you will be a better athlete. You're gonna feel it. You're gonna and Sam, what do you do for your like physical like activity right now? Is it like do you still go to the gym and like play soccer,
Um,
play with your kid?
Prior to yes, I would play soccer 2-3 times a week, um, and then I'd work out at home. Um, Set up my bike on a trainer in the garage. Work out weights, Bowflex in the garage, and then play a couple times a week. I last year I had a friend who I came out and played a couple games with early last year, which is what I thought led to the pain.
Hmm.
Um, and I apologized to her just recently, saying, "Hey, I feel bad because I went out there and I was only like 30 or 40%, you know, able to play, but it was great to get out there." Um, so yeah, I'm
Yeah,
I'm really looking forward to it because we have a we have a tournament title to defend.
that's crazy.
My team, we won this tournament. It's at the local Scottish games. It's a small sided tournament, five-a-side. We won it in 2018, 2019. No tournament in 2020 or 2021. Then we came back and won it in 2022. But then in 2023, like I couldn't play. There were a couple other guys who were banged up, so we didn't put in a team.
Hmm.
So now we're looking at this year and next year to reclaim our title.
That's exciting. When does it take place? In the fall?
Yeah, it's in September over Labor Day weekend.
You know
So
what?
uh,
And you just started walking. I think you'll be in good shape for it. I really do because I remember, and that's what I want to talk about now before we kind of like wrap up here, is the recovery. Like, what's that look like for a discrepancy patient? And I can tell you, I remember after 4 months of lengthening, or since I started my lengthening surgery, I was able to walk. About 6 weeks after that, I was back in the gym, and I know that about 8 weeks, 8 to 10 weeks after I was able to clear to walk, which is about 6 months from my surgery, I was back to the gym pretty much full time, like, working out. But about 10 months or 11 months is when I was comfortable to be able to sprint, right? And run. And I think you said in the fall, that's in the next, what, 6 months or so?
yeah,
Yeah, so right around there. So I think you're looking at a really good, prognosis for you to get back out there and do your thing. So that's incredible, man. Very, very cool. Yeah, Ethan, and for you, for like the recovery, I mean, uh, let's just take your latest X-ray and stuff. So, did you get to kind of look at it and see if there's good bone growth in there and stuff like that?
Yeah, and actually in the future, if you since I promised I'd document, myself getting back into walking and everything like that, I can also provide those as well.
That
But
would be awesome.
about each month, or this last appointment, I actually just saw my surgeon this week as well. That was 6 weeks from the previous one. But each month, I've been going back and getting a new imaging done, and I could see how bone has started to fill in each cordis, and how it, and the medial side is completely filled in now. They're happy with that, and they think I'm growing bone at a good rate. The lateral side is always the last to fill in, according to them, because that's where they enter initially and break the bone open during the surgery. So that always fills in last, according to my team. But yeah, they've kept me up to date with the images and the progress each month. They come in and address it with me after they take the images, and it looks like it's filled in very nicely. And I've been able to track the progress month by month, and they're really happy with the rate at which I was growing bone as well. So I'm happy about that as well.
Yeah, and that's why they expect you to be at full weight bearing the next 10 days or so. That's incredible. Yeah, I remember taking, all the x-rays and putting them in kind of like a Google Doc or a Google Drive, and I kind of went through them all. And I remember that it was literally, I think, for full-on consolidation, where she said you can go back to like full-on activity, was literally about, like I said, 4, 5, 6 weeks after the being cleared to walk. Because when you're able to walk, what is that? That's the nail, and then I think it's like two cortices, two cortical walls. And then for full-on activity, where it's like go back to normal life, I think it's 3. And then, like, once you get the 4th one, like, it's just rock hard, compact bone. You can do anything you want. And that's what Sam will hopefully be back for, so you can get, defend that title and get it back. So very cool, guys. Awesome. Yeah, I don't see any questions in here. Like I said, maybe it just didn't hit well. I did put out the notification a little late this week. It's been crazy, but I really do appreciate you guys coming on and sharing your experience, your updates with your discrepancies. We're going to have you guys back on. We'll do this every quarter discrepancy roundtable. So sometime in the early summer, we're going to do that. So I love to see some updates. So Sam, if you even kind of record some of your stuff, that'd be great too. If you can kind of show getting back out there, some walking, running and stuff like that, because it's just more visual stuff is good. So
yeah,
cool. And then Ethan, you going to do the same?
Yep, I'm planning to.
Awesome.
And before we hop off, I also got a question for Sam real quick.
Yeah.
I've talked to a couple other, before I ever hopped on any of these or connected with Victor for the first time, I talked to a couple other limb lengthening patients in my life, and most of them always ask me a question that's strange to me, because I've never gotten a reason for this, is they always ask me, what was the reason for your, and they know that I was born with my discrepancy, but they go, what was the reason behind it? And I always answer them that I never really got a reason. I didn't get an explanation as to why I don't have an ACL, or why one leg was developing at a slower rate than the other. But everyone else I've ever spoken to has gotten some sort of genetic explanation about it, or some sort of environmental explanation about why their limb developed at a specific deficiency compared to the other limb. Did you ever get an explanation like that from anyone that you worked with over the years, or did they just say you were born with it and that's the way it was?
They tried to explain it, and it was a combination of explanations. So they couldn't explain why my tibia and fibula were curved. They just said it's a genetic, it's a congenital thing. It wasn't genetic, but it was, it's a birth defect. It's uncommon but known. And then I got 2 reasons for why my left leg didn't develop the same way my right did. The first reason I got was that because of the curvature, even though the growth was happening, it wasn't at the same vertical rate as it was in the right leg. So that caused the discrepancy. I never really thought that was the whole story. The other explanation I got, and this is why I have 2 different size feet, is that I had the first consultant I had when I was right after I was born was more of a bone specialist rather than a neonatal specialist. And so his way of trying to correct the issue was simply to put my foot and my leg in a cast. Mm-hmm. And it was 2 weeks on, 1 week off for the first year of my life. So, 2/3 of the first year, I wasn't growing. My shin and my foot weren't able to grow because they were in a cast. And so I think it's probably a combination of those things, but really those are kind of the explanations I was given. Mm-hmm. And it was kind of left at that of this is what we think caused your discrepancy. And they realized that there would be a discrepancy early on. And so growing up, every 6 months I had to go and get x-rays. So they realized there was a discrepancy, and they were cataloging that discrepancy to see if it would grow larger, grow smaller, stay at the same. So, but yeah, I never got an explanation that I was satisfied with of why this discrepancy happened.
And also of note, since you mentioned it, as someone who also has 2 different size feet because of the variety of factors at play, isn't that such a pain when buying shoes?
Oh my God. So I found that Nordstrom, if you go in, if you're more than a size and a half difference, they'll mix and match in the box for you and only charge you for one pair.
Oh, wow.
That's good to know.
I found that out when I was like in my mid 20s, so like 15 or so years ago. But yeah, prior to that, it was if I wanted like nice shoes, I had to buy 2 pairs. Or like growing up, it was always go to like Payless Shoes or something because you can get $10, $15 shoes in 2 sizes, and then it doesn't matter that you have 2 shoes that are brand new that you can't wear, type thing. The soccer cleats were just the worst. I basically everybody else was getting new whatever the brand new cleats were, but those are like $200-$300. I can't double that up, so I would have to wait until like last year's editions went on sale and get them for a discounted price. And I remember once in college, I ordered some shoes, and one of them just did not fit, and so they were sold out by the time I went back to try and get another pair. I think for my left foot, they were sold out of that size. So for 1 year in college, or maybe it was half a year, I had 2, like I had a Nike on one foot and an Adidas on the other. Like they were completely different shoes. And it was, that was my nickname at, when I started college, my nickname was Littlefoot. So yeah. Yep.
From the
annoying. Still annoying.
I love it. What's the difference in your feet? Is it an inch?
It's 2 sizes. So
2 sizes. Wow.
Yeah. So I have my right foot is a 10 or 10 and a half. My left foot's actually a 7.5, 8, depending on the shoe manufacturer.
Yeah.
Yep.
That's got to be annoying. But yeah, you're right. If you go to Nordstrom now, you found that out. You're like,
yeah, I found that out. Unfortunately, like the Nordstrom shoes are expensive already. It's not like I'm getting that much of a savings because they carry the top line stuff. So it's, but for like business shoes or something, or even some high end running shoes, that's where I go to get them.
Yeah, and then it looks the same, then nobody can tell. But I think that you could definitely be like kind of like an advocate for them. It's like, hey, do you have different size feet? Like, sell those shoes. No, and what was I going to ask Ethan? I had a question. Just slipped my mind. It was actually a pretty good question too. Can't remember it. Ethan, do you have any other questions while I think about that? Shoot.
I don't think so. No.
Okay. It was for you. Darn it. Just a second. Can't think about it. That's okay. If I think about it, I'll shoot you an email. But
it'll come to you at the most inconvenient time, I'm sure.
I know, right? Right when I press end.
Right when you press end.
Yeah, exactly. It'll come on right then. But no, guys, this has been huge. It's going to help out a lot of people with discrepancies. Kind of basically say, if you guys have a discrepancy that's large enough, it's symptomatic, it's bothering you. Oh, that's right, Ethan. I'm sorry. Before I finish my outro, it's you asked Sam, is like, does he have an explanation for his congenital condition of his discrepancy? And the really cool, the really interesting thing is that for congenital conditions, they know what it is and how it's described and stuff, but a lot of them, they don't even know how it happens. Like in Sam's case, it was probably like different growth rates of like you said, the different one side of the tibia versus the other side. But for like, let's say CFD, they'll tell you their supposed explanations, but in the body during the fetal's, growth and stuff like that, it's just crazy. Like there's so many different growth factors and things that go on and cascades and stuff. So it's hard for like surgeons to put their finger on and say, that's exactly what happened. Whereas in my case, I know I fractured the growth plates. I know I had a malunion. It's very, very easy to say. But did they tell you, Ethan? They never gave you an explanation, you said?
No, what I found strange about it is not that not that I didn't get an explanation, because obviously, like you said, there's so many factors at play, especially when you're looking retroactively into the past. When we discovered mine between when I was 5 and 7, but it's that most people that I know that have a discrepancy, their team kind of made an attempt to get at the root cause of it or figure out and that was never a part of my experience. Not saying for better or for worse necessarily. I just found it odd that in my case there really was never an origins attempt at explaining what came about of it. It was really just focused on the next step with treatment.
Oh, I see what you're saying. So they didn't even kind of like deem it a condition like tibial hemophilia or anything like that. Like they didn't have any. They just said it was from birth. That's it.
Yeah, pretty much.
Gotcha. Yeah, that is a little interesting. Yeah, I think that it also takes experience. Like if you go to like they're the top surgeons in the world, like they'll probably like, we've seen this case enough that we've actually kind of classified it under this type of umbrella of this type of discrepancy or congenital condition. And that's kind of weird because there's different ones and nothing looks the exact same. No cases like textbook, like that's tibial hemophilia, it's going to look a little different in everybody's case. So very cool. Awesome. Thanks so much guys for coming on. Like I said, anybody who's watching out there who has a leg height and an imbalance that's symptomatic, it's bothering you, at least go ahead and set up a consultation with the orthopedic surgeon, see if they can do the block method to measure your discrepancy. And if it makes sense, if you have a lifestyle that's very active and you don't want to live with this issue for the rest of your life, maybe consider limb lengthening as an option. But shoe lifts work just as well. If you're not as active, you can just kind of live perfectly well with that. I did for a while. I'm sure these guys did as well. But yeah, so that's pretty much all I have to say. So you guys have anything to say to your discrepancy people out there? All good?
Just before we sign off, all I have to say is that for anyone out there that's listening, I think that what Victor does here is very useful, and I think that it for me personally. But when I was coming off all the surgeries I've had from when I was younger, and I still had a significant gap to close, and I was making the decision to get this one done, it was a very dark and depressing time. And his library of videos and his experience being able to sympathize and share a lot of aspects with what he went through in my own case, it was very helpful to me at the time, and it still continues to be. And I think that anyone else that's dealing with these same circumstances, well, I think it's your videos are a very useful resource, and I very much appreciate how much effort you put into it and how you've built up this platform for those people.
Thank you, Ethan. Appreciate that a lot, man. Really do. Awesome. All right, guys, for episode 116, I think. I don't have it actually listed here. So is it 116? I don't know. I didn't look at the last episode. For Limb Lengthening Live, I want to thank our limb lengthening discrepancy patients here. We got Sam, we got Ethan. We'll have them back on hopefully to kind of give them some updates with some footage if they have it. And thanks for everybody who watched today. And until next time, this is Victor from Cyborg for Life, signing out. See you guys next time. Bye.